Uneven hips? How to fix it? Do you get the impression that one of your legs is longer than the other? Hip misalignment might be to blame. While it's always advisable to get a medical diagnosis before attempting any therapies, there are a few exercises and stretches that may help realign your hips and provide some comfort. We'll go over all you need to know about misaligned hips, including the key medical causes. You may realign your hips with some at-home therapy and the assistance of a medical practitioner. Your pelvis includes your hip bones. Your pelvis is tilted if your hips are unequal, with one hip higher than the other. This is also known as a lateral pelvic tilt, and it is caused by only a few factors. The symptoms and therapy are determined by the cause of your unequal hips. The following are the most common causes of unequal hips. Scoliosis, which can range from moderate to severe and evolve over time. A functional rather than anatomical variation in leg length caused by posture and stance. A physical or anatomical difference in your leg lengths. Scoliosis. Back X-rays are routinely taken every 4 to 6 months in children with a minor spinal curvature. Unless the curvature worsens, it is not addressed. Only around 10% of persons with scoliosis have a severe enough condition to require treatment. Doctors may advise youngsters over the age of 10 to wear a back brace while their bones are still developing. It will not fix the spinal curvature, but it will prevent it from worsening. It is normally worn both day and night, unless it interferes with sports or other activities. Doctors may propose surgery to fuse the vertebrae together with a rod or artificial bone to arrest the advancement of the curvature in situations with severe or fast-progressing scoliosis. Functional leg length discrepancy. When the measured length of your legs is equal, you can do numerous things to rectify unequal hips. Massage can help you relax your muscles and eliminate knots. Exercises that stretch the side with tight muscles can enhance your leg and hip mobility and range of motion. These are the most common treatments for crooked hips. Muscle strengthening exercises are also beneficial. It is also critical to rectify any improper posture so that the condition does not reoccur. Structural leg length discrepancy. It is more difficult to correct uneven hips when the measured length of your legs is unequal. Treatment is depending on the discrepancy in leg length, according to the Pediatric Orthopedic Society of North America. Young toddlers and teenagers who are still developing may only be monitored until bone growth stops. Wearing a lift in the shoe on the shorter leg can help relieve back discomfort and enhance the ability to walk normally. This is the standard therapy for minor leg length differences. Surgery to level out the leg length may be considered in more severe situations. When the length discrepancy is between 2 and 5 centimeters, a surgical treatment is frequently performed to stop or reduce bone development in the longer leg. When the discrepancy exceeds 5 centimeters, a more difficult treatment that lengthens the shorter leg is frequently performed. Alignment check. Check the crests of your hips for evenness. In front of a mirror, stand up straight and lay your hands on your sides, positioned between your waist and hips. Feel around your belly for the crests of each hip. If your hands are both level after finding the crests of your hips, your legs and hips are probably level as well. If you're having problems locating your hips, see this anatomy diagram. This will make it easy to see where your bones are. While you're lying down, have a buddy check the length of your legs. Lie down on a flat surface with your legs as level and straight as possible. Check the alignment of your inner ankle bones with a buddy. Then, gently sit up as your companion holds your ankles and watches their position. You generally don't have any alignment concerns if your ankles are still lined up after you sit up. If one ankle is now longer than the other, you may have an alignment problem.